So, your dog has been diagnosed with mammary tumors. You know that managing inflammation is a huge piece of the puzzle, but what if I told you that the most common treatments could actually be a double-edged sword, that they might even be helping the very cancer we're trying to fight? We really need to unpack this, because the choices we make here can change everything for our dogs.
And that really gets to the heart of the matter. When we're up against canine cancer, is it enough to just fight the symptom of inflammation? Or could that approach, unintentionally be making things worse? We're going to dig into this whole issue from the perspective of functional veterinary medicine.
So here's what we're going to cover. First, we'll talk about why treating inflammation is such a dangerous paradox. Then we'll look at the two big players, steroids and NSAIDs, and break down the good, the bad, and the ugly. After that, we'll explore a completely different way of thinking, a functional approach, and we'll wrap it all up with the single most important thing you need to remember.
Okay, look, for any cancer patient, keeping inflammation in check is absolutely vital. You want to make the body a really unwelcoming place for cancer. But here's the trap. The very treatments we use to do that can sometimes roll out the red carpet for cancer, creating the perfect environment for it to grow and thrive.
Right, let's kick things off with a big one, steroids. Now, steroids are incredibly powerful in knocking down inflammation, no question. But for a dog with cancer, they can act like a shield. Not for your dog, but for the cancer cells themselves. They hide the real problem while it just keeps getting worse under the surface.
And this is where it gets so tricky. On the outside, you see improvement. Your dog looks and probably feels better. The swelling goes down, they seem more comfortable. But inside, a completely different story is unfolding. The body's own internal security team, the immune system that's supposed to be on patrol 24/7, hunting for cancer cells, is basically told to take a coffee break. And that gives those cancer cells a free pass to multiply like crazy.
So, to break it down, steroids create this perfect storm of problems in three major ways. First, they shut down a key part of the immune system called Th1 cells. Think of these guys as the elite special forces, trained specifically to seek and destroy cancer. Steroids tie their hands. Second, they spike blood sugar. And guess what cancer's favorite food is? Sugar. So you're literally feeding the tumor. And third, by making your dog feel better, they mask what's really going on, giving everyone this false and frankly dangerous sense of recovery.
Okay, so if steroids are that risky, what about something else? Let's talk about NSAIDs. That's non-steroidal anti-inflammatory drugs. These are super common, but they're a real mixed bag. There's a story of light and shadow here, with some definite pluses, but also some really significant long-term costs.
And this chart really lays it out. On the good side, NSAIDs can sometimes directly slow tumor growth by blocking something called COX-2, which tumors love to use as fuel. Plus, they manage pain, and that's huge for quality of life. But then there's the flip side. Long-term, they can seriously damage the gut lining, we'll get to that in a second, and they put a massive strain on the liver and kidneys, which are already working overtime to deal with everything.
And that side effect, leaky gut, is such a big deal that we have to stop and talk about it. Imagine your dog's intestinal wall is like a secure border checkpoint. Well, long-term NSAID use can punch holes in that border. This allows all sorts of nasty stuff like toxins and bacteria to leak straight from the gut into the bloodstream. And the result? You get massive body-wide inflammation, which is the very thing we were trying to stop in the first place.
So, if the standard ways of doing things have all these risks, what's the alternative? Well, this is where a functional approach comes in. It's a totally different philosophy. Instead of just attacking the disease or suppressing the symptoms, the whole goal is to rebuild the body's own natural defenses and fix the underlying issues that let the cancer get a foothold to begin with.
So what does that actually look like? Well, it's a three-part strategy. First, you rebuild the castle wall. That means repairing the gut lining to stop those inflammatory toxins from ever getting into the bloodstream. Step 2 is all about precision. Instead of nuking the whole immune system, this approach is like a smart bomb. It targets very specific communication signals that cancer cells use to grow, like one called STAT3, without all the collateral damage. And step 3 is to cleanse the terrain, basically helping the body cells stay hydrated so they can flush out all that inflammatory garbage.
And this all boils down to one single crucial idea. It's a fundamental shift in how we think about this, moving away from a strategy of brute force suppression to one of smart, careful modulation.
This quote from the source veterinarian just says it all. Modulation, not suppression, is what's needed. The goal isn't just to shut off the alarm bell of inflammation. The goal is to rebalance the entire body, to make it a place where cancer simply can't thrive. That's how you get powerful treatment without all the awful side effects.
So I want to leave you with this question to think about. Take a hard look at your dog's treatment plan. Is it just aimed at the symptoms, at putting out fires? Or is it truly designed to get to the root of the problem, to strengthen the body and to heal from the inside out? Because asking that question, well, it could make all the difference in the world.